Hello, everyone. Welcome to Federal Tools for Environmental Justice. I'm just going to wait a couple of minutes to get started because I know it usually takes a few minutes for everyone to log in. Hello, everyone. I'm going to go ahead and get started. Welcome to Federal Tools for Environmental Justice, Understanding and Addressing Health Disparities and Community Impacts. I'm going to go over the agenda a little bit to let you know what to expect from the webinar today. So just by way of introduction, it would be great if you could go ahead and head over to a couple of polls we have available on Mentimeter. The instructions for how to access those are available now on the screen. And please go ahead and answer two questions. What federal tools do you currently use or have you used in the past? And what feelings come to mind when you think about federal tools? And when I'm done introducing the speakers, you will see the results of that poll, and our speakers will be better informed about the audience who is attending today. We will be covering a number of tools today, including the Social Vulnerability Index, the Environmental Justice Index, and the Data Explorer with the National Center for Environmental Health Tracking Network. And there will be an opportunity for you to ask questions of each speaker after they introduce each of these tools. And at the end of the overall discussion and presentations, we will have a broader Q&A and an opportunity for further discussion. After that, we will wrap up. You should also see some tools, some links to the tools appearing in the chat, and be able to get started accessing those as well. This webinar is part of a learning series called From Silos to Synergy, Integrating Land and Water Programs for Holistic Environmental Action. And you'll also see the link to that in the chat as well. Basically, it is a series that's focused on looking at how land, air, and water systems are deeply connected and learning about tools and strategies for healing past harms and undoing legacies of environmental discrimination from a holistic perspective and a data-informed perspective. The series is designed to help land and water equity practitioners think beyond traditional program silos and to create a comprehensive picture of what communities are experiencing on the ground. The series is hosted by the Urban Waters Learning Network, which is co-administered by two organizations, Groundwork USA and River Network. And you can learn more about the Urban Waters Learning Network by signing up for with our Mobilize platform, which there should be a link in the chat to that now. And you can get involved with other practitioners who are involved in this kind of work and learn more about what we do. It is my pleasure to now introduce the speakers who are on the line today. We will start with Elizabeth Templeton, who received her Bachelor of Science in Health Promotion and Behavior from the University of Georgia and her Master of Public Health and Epidemiology from the University of Alabama at Birmingham. She has worked in various public health areas throughout her career, including nutrition and exercise, healthcare-associated infections, foodborne illnesses, HIV, COVID-19, and most recently, the social vulnerability in geospatial science. Elizabeth joined GRASP in July 2020 as a senior project coordinator for COVID-related projects and has since moved to lead the Social Vulnerability Index offered by the CDC beginning in early 2022. And she will share with us the Social Vulnerability Index and also the interactive map that you can use. Then we have Benjamin McKenzie, who is a geospatial epidemiologist and health scientist with the Geospatial Research, Analysis, and Services Program at the Centers for Disease Control and Prevention and the Agency for Toxic Substance and Disease Registry. Mr. McKenzie serves as the team lead and principal investigator for the Environmental Justice Index, an EJ mapping tool that measures the cumulative impacts of environmental, social health, and climate-related burdens on communities. In this capacity, Mr. McKenzie works closely with the National Center for Environmental Health and the HHS Office of Environmental Justice, who are partners in developing and supporting the EJ Index. Mr. McKenzie is a committed advocate for the application of geospatial sciences to promote health and health equity. And finally, we have Mitra Kashani, who is an ORISE Fellow with the National Center for Environmental Health Tracking Network. She helps develop environmental health surveillance indicators and measures for the tracking network's publicly available data explorer, which integrates non-infectious disease, environmental, and socioeconomic data from various sources. Mitra has been with the CDC since October 2021 and received her master's in microbiology from George Mason University in 2020. And with that, before I turn it over to the speakers, I'm going to go ahead and share the results of those polls so that you can all see them. Okay, so we have a lot of use. I hope everybody can see that. We have a lot of use of the EPA EJ screen, and it looks like one person has used NOAA EJ tools and resources. One person used Department of Energy Justice Dashboard. A few people have used the SVI index. But yeah, it looks like there's a lot to learn here today. And there is, by the way, a new version of EPA EJ screen. We will send out a link to that. We will follow up with additional links and resources after this webinar with more information about that. I've been on mute this whole time. I'm so sorry.
No, we've heard you.
Okay. All right. It muted me, I guess, automatically for some reason. Anyway, so we will follow up with relevant links and information after this webinar. So if you would like to respond to the other category here, feel free to post that in the chat if you have any other federal tools that you want to share that you've used. Okay, and then we have 0 responses to this one. Does anyone want to go ahead and follow that second link? What feelings come to mind when you think about federal tools? I think this will be really useful for our presenters today to see these. I see a lot of challenging navigation issues, high learning curve, right? Overwhelming. And while you are adding this information, it would be great if you can think of questions for the presenters or offer comments and feedback for how to improve some of these challenges, since these are very focused on the challenges that you all are experiencing. Okay, it looks like folks have had a chance to share, and complex is the biggest word. So great. Okay, I'm going to pass it over to our speakers. First, I will just say that these tools are really valuable for lifting up community priorities and showing how community-led transformations actually transform into benefits to communities. They're really useful for working with decision makers and building coalitions. So as you know, I want to acknowledge that we're entering a new climate of uncertainty, and it will be more valuable than ever to know about these tools and to have access to them and to offer feedback on how they can be improved. So with that, I'm going to go ahead and turn it over to our speakers.
Wonderful. Thank you so much. I will go ahead and share my screen here. If you can let me know if you can see my screen. Okay, perfect. Well, thank you very much. And yes, I am Elizabeth Pembleton, and I am a geospatial epidemiologist with the Geospatial Research Analysis and Services Program at the CDC and ATSDR. And I lead the Social Vulnerability Index, as was mentioned. I am a white woman with brown hair, currently in a bun, and I'm wearing a white shirt with a black blazer. And today I will provide information on the Social Vulnerability Index regarding its history, the purpose, construction, a little bit of the use, and then walk through the web pages that we have, including the interactive map. So for a little bit of history, the Pandemic and All Hazards Preparedness Act of 2006 cited that public health preparedness and response capabilities were critical needs for the nation. So all federal agencies were required to respond to this. So the CDC decided to address social vulnerability as it relates to natural or human-caused hazards and public health emergencies. So a group of social scientists and statisticians in GRASP began developing the Social Vulnerability Index in 2007, and the first iteration of this was released in 2011. So every single community in the United States exhibits varying degrees of vulnerability to hazards and other public health emergencies. However, a community's social vulnerability plays an important role in its response to and recovery from hazardous events such as disease or disasters. So the social vulnerability refers to the demographic and socioeconomic factors that contribute to communities being more adversely affected by public health emergencies and other external hazards and stressors that can cause disease and injury. So as an example, poverty or lack of access to transportation and crowded housing may weaken a community's ability to respond and adapt to public health emergencies. So measuring and tracking social vulnerability contributes to efforts to address social disadvantage within communities and therefore hopefully to decrease human suffering, health disparities, and health inequities. We developed the Social Vulnerability Index, or the SVI as I'll refer to it as well, as an index, a database, and a mapping application to assist public health practitioners with identifying and quantifying communities most impacted by social vulnerability in their jurisdictions. So the Social Vulnerability Index is composed of Census Bureau data from the 5-year American Community Survey, or the ACS, and this is to measure the relative social vulnerability of United States communities. Currently, the SVI includes data on 16 sociodemographic variables, as we can see here on the right-hand side of this image. And then we group these 16 variables into 4 themes that cover 4 major areas of social vulnerability. And then lastly, we combine these 16 variables into this one measure of overall social vulnerability. For the SVI, we use percentile ranks to score the social vulnerability of a community on a scale of 0 to 1, with 1 representing the most vulnerable or the highest level of vulnerability. And we've provided the SVI rankings for each of the 4 themes as well as for the overall ranking. The 16 variables are equally weighted, as are the 4 theme rankings as well. And we do this to try to provide a simple and easy to understand approach to the methodology. However, it is important to note that we do encourage people to tailor the SVI based on their local knowledge of the communities. So, because the individual indicators may vary geographically, uh, users may want to weight the data as they see fit. Um, we have the SVI at 2 geographic levels currently, the census tract and county level. Counties are larger geographic areas, and the smaller census tracts are nested within the counties. We also provide these rankings compared at both the nationwide or statewide scale. So the nationwide comparison ranks a county or census tract against all other counties or census tracts within the US, whereas the statewide comparison ranks a county or census tract on all other counties or census tracts within the state only. And we've developed and validated SVI databases for the US Census tracts and counties at both national and state levels. And we also include databases for Puerto Rico and census tribal tracts. Puerto Rico and the tribal tract databases are both standalone databases. The Puerto Rico information is only available at the statewide comparison, and the tribal tract database includes estimates, percentages, and the respective margins of error along with the adjunct variables, but they are not ranked against each other nor against standard census tracts. And since the start of SVI in 2007 and the release of the first database in 2011, we've produced 7 SVI databases for the years shown here, and with the new databases updated every 2 years. So we release a new database every 2 years. This is an example of the 2022 map here, in which you can easily distinguish areas of increased social vulnerability based on that dark blue color. And then next to this map over here on the right, you can see an example of the database. And in addition to the maps and the overall index we create, we also provide the raw data for each census tract and county in the US. So we've found that these data are useful for those who want to know how many people in a specific vulnerable group reside in their communities so that resources can be focused and allocated, hopefully, to those most in need. We also have the county map series, and we provide this for every US county. And this displays the social vulnerability at the census tract level for the county of interest. So for an example, this is DeKalb County, Georgia, which is where the CDC is located. And we see the overall vulnerability map on the left here, and then maps of the 4 SVI themes on the right. And these maps visually illustrate variable patterns of social vulnerability within a county. And we have seen that these maps can help identify the types of vulnerability that might require more attention and can be a useful way to quickly understand communities and hopefully provide some additional insight and may potentially spark some additional questions that can provide a basis for a deeper dive into the SVI variables and what factors might be driving the overall vulnerability in an area. In terms of the use of the SVI, the SVI was originally designed to measure the social vulnerability of communities in relation to natural disasters or public health emergencies, as a way to identify the communities most in need of assistance. But these original aims of SVI are described in this planning for an emergency document. But although these are the more traditional uses of the SVI, we've seen that the SVI has been used in a wide variety of research and public health practice contexts. So, including studies of communicable disease outbreaks and transmission, chronic diseases, maternal and child health and health risk behaviors. And one of the most notable developments in SVI has been the widespread application of this tool in regards to research involving COVID-19. So there's just a lot of different ways that SVI has been used. So as a quick summary, before I dive into a demo, the SVI combines 16 demographic variables, demographic and socioeconomic variables from the U.S. Census Bureau. And we provide these rankings for all census tracts and counties and provide these scores on a scale of 0 to 1, with 1 being the most vulnerable, 0 being the least vulnerable comparatively. And although the SVI was originally developed to help communities prepare for, respond to, and recover from natural disasters, the SVI has been shown to be useful to assist communities during really any public health crisis. So I will now switch over here to the SVI web pages. So I'll just provide a quick overview of what we have available here and then dive into a demo of the tool. So we have several pages. This is our main social vulnerability index page, which provides an overview, history, some of the methodology, which are some of the things that I just went over in this presentation. But then we also have some information about how the SVI has changed over time, which is important to note. We have talked about how SVI has been used. We show the SVI county map series and how to get to those county maps, and then some additional other pages here down at the bottom, but you can also find this information over here on the right. I'm going to skip over the interactive map for just 1 second because I'm going to end on that one, but I want to show the documentation and download page because this has a lot of really, really helpful information. So first of all of the data are available to download here. So each year of the data set, each data set we have available for the 7 that we have, you can download there, select the geography that you're interested in, if you're looking at census tracts or counties, and if you want to download a table or the geodatabase. The documentation, I think, is one of the most helpful things that we have. This has a ton of great information about the SVI and some really specific details. So if you have questions about things, this is definitely where I would go first. And on page 7 of this documentation is where we have our data dictionary, which is where we list every single variable included in the database, including a description of the variable, which theme it is part of, where we obtain the original data, and how we calculate everything, which it can be a lot of information here. So it's really great that we have this listed literally step by step. We also have suggested citations and data changes over time, including this data table, or this chart actually, which can be really helpful to see the differences in the data sets over the years. I will also show our publications and use cases page. This has a lot of information about how SVI has been used. We have these publications, this database of 522 journal articles that have used the SVI, and you can search through here as well if you're interested in a certain topic relating to SVI. We have certain websites that have used the tool, as well as some other white papers and reports as well.
Elizabeth, I'm so
Yes.
sorry to interrupt, but we have a couple of requests to zoom in if it's at all possible. I think some of this is kind of hard to see.
Is that helpful? Is that better?
Yeah.
Hopefully that's a little bit better. Okay, great. So we also have our educational resources. So on this page, we have a video of just some high-level information about the SVI, as well as an academic toolkit where we have a presentation pretty similar to this, the one that I presented today, a toolkit in terms of a research project for students to use, and then our studio exercises if someone wants to kind of build their own project using the SVI as well. So this can be helpful in an educational setting. And then lastly, we have our frequently asked questions, which is another great place to come if you have some questions after reading through the documentation. These are some frequently asked questions, so ones that can be really helpful. We do also have some news and updates and some highlights here. But I do want to make sure to have plenty of time to go through our interactive map here. So this interactive map has all of the information that we've talked about so far in one place. So again, we can look at the overall SVI or each of the four themes. We can look at nationwide or statewide. So again, this is the nationwide comparison. So looking at, McIntosh County, Oklahoma, compared to all other counties within the United States. Whereas if you wanted to look at a certain state, for example, Georgia, then you could look at Henry County compared to all other counties within Georgia. So this is just a more local view of the information. If you zoom in to a zoom level of 8 or higher, you can look at census tracts as well. And we just need to zoom in enough so that you can see the census tracts. Otherwise, it kind of, since there are so many, it essentially breaks the site if we try to do census tracts too far out. So that's why you have to zoom in a little bit. But you can look at the census tracts within the counties. You can click on this information and see the SVI ranking. And you can also look at the different years of the data sets. You can download the data either as the map or the data, including all of the information that you're interested in seeing. We do also have this table tab, which again is very similar to the data that you can download from the data and documentation download page. But this is just a way to kind of scroll through everything and see this maybe a little bit more visually. It has all of the information for the variables and what the variables mean. The more description is listed here. You can sort and filter each of the columns, and you can search for anything you'd like as well. And then lastly, we have this more information tab, essentially, where this has some information about the citation, some additional resources about where we provide or where we obtain some of this information, some helpful links, and then this is where you get to that county map series in terms of like how I showed in the presentation with DeKalb County. So this was a whole lot of information, I know, but hopefully this is a good overview of what we have available, and hopefully it's clean and clear. But of course, if you have any additional questions that I can't even answer during this presentation or we don't have enough time, please feel free to reach out to the SVI_coordinator at cdc.gov, and that will come to me, and I will be happy to answer any questions.
Okay, I'd love to get to some questions from the chat. So Annie asked, did you say that the census tracts are not being compared to each other? So are the tracts being compared to predetermined thresholds for high and low vulnerability? If so, how are these thresholds determined?
Yeah, great question. So they are being compared to each other. So that's a county if we're looking at the statewide comparison, we're looking at one county within the state of Georgia, let's take for example, and then we're comparing that to all other counties within the state of Georgia. So then we rank those from 0 to 1, and 1 is the most vulnerable and 0 is the least vulnerable. So we have like that range of ranking within the state of Georgia if we're looking at the statewide, but we do that similarly for a nationwide comparison. If that makes sense.
Great. And then we have another question from Deanna. How does the SVI relate to EPA's Inflation Reduction Act Disadvantaged Communities map? Are these different tools spitting out in the same information? And is there guidance to direct users to which federal tool is most useful for a given scenario?
That is also a great question. I'm not very familiar with the other tools, so I can't do a great comparison of the two in terms of what we provide versus the other. But uh, but yeah, we provide all of this information from the 5-year ACS community American Community Survey, which is all publicly available data. So it is very likely that there are other tools that are using this information as well. It's just these are the 16 variables that we pulled together for the Social Vulnerability Index.
Ben, you have your hand up. Do you have some insight on this?
I was just going to hop in with a very quick. I wanted to say I want to kind of maybe flag that for maybe a question at the end where we can all kind of weigh in. So there are definitely some differences between the SVI and the EPA's Inflation Reduction Act Disadvantaged Communities Map. They're pulling from a different tool that's created by the White House, the Climate and Economic Justice Screening Tool. But I think that question about kind of how to use it, all of these tools are using similar data, like Elizabeth mentioned. But I think that the question about, which tool to use and in which circumstance is a good one to kind of maybe flag for the end, because I think that kind of relates to all of our tools as well.
Great. And Annie, did you have something that you wanted to add?
I just had a follow-up to that answer. So if the census tracts are being compared to each other, what happens if, say, all of the tracts in Georgia are technically high vulnerability, whereas, I don't know, all the tracts in California are or vulnerability? I'm just wondering if you're comparing the tracts to each other and to not a pre-established threshold, wouldn't some of these high vulnerability areas be left out or ranked in a way that isn't reflective of that community?
Yeah, the so just kind of thinking about things in terms of Georgia or looking at the nationwide. So I'll talk about the nationwide comparison because that can be that can hopefully be helpful in terms of thinking about Georgia compared to California. So the way that the SBI is created by these relative rankings is it's just a way to try to compare each county or census tract against each other so that we don't have to create a threshold essentially. Like they're all compared to each other so that that way there there's always going to be the most highly vulnerable, there's always going to be the least vulnerable, and there's going to be an equal amount of counties or census tracts in between. So basically, it's just a way to make sure that we're including everything and putting everything into one equal measure, essentially, so that we can look for those areas that are more highly vulnerable. And to kind of get to your other question, like there might be some areas that are very highly vulnerable in Georgia compared to California. And if we're looking at this nationwide comparison, we can look at that. We can see, okay, this county in Georgia is, highly vulnerable. And how does that compare to a county in California? And it will be equally compared, essentially. But if we are looking at just within Georgia, then it won't take into account, if we just look at the statewide comparison, it won't take into account California. And we're just going to be looking at within Georgia, where are the areas that are more vulnerable versus least vulnerable. I hope that makes sense.
That makes a lot of sense. Thanks for answering that.
Oh, of course, of course.
Okay, I want to make sure that we have time for the other presenters. We will have more time for questions after everyone has a chance to present. So I'm going to go ahead and turn it over to Ben.
Thank you so much,
Thank you,
Maria. And
Elizabeth.
I'm sorry. Thank you, Maria. And I'm going to go ahead and try and share my screen. So please let me know Can someone just verbally confirm that they can see? Oh, it's going to take just a second. Can someone verbally confirm that they can see my screen?
Yep, we can see it.
Perfect. Thank you so much. And thank you all for joining us today. As Maria said, my name is Ben McKenzie. My pronouns are he, him, his. For descriptive purposes, I'm a white man with dark hair, a beard, and glasses, and I'm joining you through Zoom with a blue CDC ATSDR background behind me. So I'm, like Elizabeth, a geospatial epidemiologist with CDC ATSDR and the GRASP program there. And I'm here to talk to you all today about the Environmental Justice Index, our environmental justice mapping tool, and how a cumulative impacts approach is advancing environmental justice and health equity. So I want to start at a very, very high level here, with some information that's probably, familiar to everyone. But I want to kind of focus on the link between environmental justice and health equity, starting with, what is environmental justice, which I'm sure most folks on the call are pretty familiar with this concept. But environmental justice means the fair treatment, or the just treatment of all people, regardless of income, color, national origin, tribal affiliation, or disability in environmental decision making. It means protecting people from environmental burdens. So actually getting on the ground and protecting people from environmental burdens, including those that come as a legacy of racism and inequality, and ensuring everyone has equitable access to healthy environments. So this definition, which comes from a recent US presidential executive order on environmental justice, addresses some key aspects of environmental justice, including procedural justice, that is ensuring that communities have a voice in environmental decision-making, and distributive justice, addressing existing environmental health disparities. And it's because of these disparities that environmental justice is inextricably linked to health equity. So in addressing environmental injustice and health equity, CDC and ATSDR, in partnership with the US Department of Health and Human Services, developed the Environmental Justice Index, or EJI, as a tool to help to address environmental injustice and the health disparities linked to injustice by identifying and visualizing where US communities are facing the cumulative impacts of environmental burden and injustice on their health and well-being. I'm going to take just a second to focus on that term, cumulative impacts, because it's a really key one for our tool. So cumulative impacts are a measure of the total harm to human health of multiple environmental burdens, chronic health conditions, and social stressors, sometimes referred to as chemical and non-chemical stressors. So we know that social and neighborhood level determinants of health don't act on health in isolation. Most people face multiple environmental exposures in their daily lives, as well as interactions with their built environment that can affect their health. The effects of these environmental burdens on health can be made worse by social factors, like poverty or lack of health insurance, and by key pre-existing chronic health conditions like asthma. All of these factors, environmental, social, and biological or health related, can have cumulative impacts on health and well-being. So the EJI, which was first released in August of 2022, provides a single index rank that distills community level data on environmental, social, and health factors into a single understandable measure that can be used for context and comparison when thinking about how to tackle injustice and to promote health. So over on the right, you'll see what that looks like for DeKalb County, Georgia, which is where I live and work. This map shows the communities facing the most severe cumulative impacts of injustice in my county, those in the darkest shade of green. These are communities where it is critical for us to address injustices in order to move towards health equity. In just a bit, I'll demonstrate how to use our interactive mapping tool and our other materials to go a bit further in exploring these data, but I want to just provide a very quick background on the methods used to create the EJI. So to measure cumulative impacts in communities, The EJI actually draws from something called the Environmental Justice Screening Method, or EJSM, which is a method of measuring cumulative impacts originally developed by environmental justice advocates and academics back in about 2011. So the EJSM has been adapted by many governments, particularly state and local governments, scholars, and community groups to produce cumulative impacts screening tools that combine the best geospatial data available for their jurisdictions. But the EJI is the first one to do that at the federal level. Some examples of state level cumulative impacts or EJSM screening tools include state level tools like CalEnviroScreen and the Washington Environmental Health Disparities Map and others. And the EJI builds on these and other environmental justice and cumulative impacts screening tools and methods, including tools like EPA's EJ Screen, in response to calls for a nationwide approach to measuring the cumulative impacts of environment and injustice on health. So our methods may seem complex at first. There might be some people kind of freaking out at this slide at first, but I'm going to try to talk through them in a way that makes them feel maybe a little bit more approachable. So the EJI is calculated using data from several US federal agencies, and it's calculated at the unit of census tracts, which Elizabeth mentioned before. It's the finest unit at which the SVI is available, and it's often used as kind of a statistical approximation of a neighborhood. In the 2010 census, there are about 72,000 populated census tracts in the US. I think that's up to about 83,000 as of 2020, each with an average population of about 4,000 people. So that's kind of the basic unit that we're talking about here for EJI measurement. The EJI index consists of 3 modules representing what we see as the 3 building blocks of cumulative impacts: environmental burden, social vulnerability, and health vulnerability. These 3 modules include a total of 36 indicators, each calculated using nationally representative data sets, and each measuring a distinct environmental, social, or chronic health condition. The EJI combines these or measures and combines these using a percentile ranking method, just like the SVI, which means that the value of a given indicator or an overall index score for a given census tract is calculated by ranking that census tract against all other census tracts in the US, with a rank of 0 representing the lowest values and a rank of 1 representing the highest. These methods are widely used, peer-reviewed, and tested, and hopefully have the advantage of being relatively simple and easy to communicate to a range of users with varying backgrounds. And like SVI, these methods are also easy to adapt to local needs and circumstances, which is a key concern for that procedural justice aspect of environmental justice that I mentioned before. So with all of that background, let's take a look at how you can learn more about the EJI and interact with EJI data. So I'm actually going to demo using screenshots today because it's a bit stormy here in Atlanta, and I'm not confident in testing my internet connection too much, but I can certainly use a live demo to answer any questions or demonstrate something at the end here. So the first place you can find information on the EJI is our landing page, which can be found at eji.cdc.gov. And here you can find a lot of information on the EJI, as well as navigating directly to the EJI Explorer, which offers a way to visually interact with EJI data. This is that EJI Explorer. It's an online tool open to the public, which displays the relative ranks for cumulative impacts of environmental injustice grouped into national quartiles. And what that means is that the tracts shown here in the darkest shade of blue, have an EJI rank of at least 0.75, and so experience more severe cumulative impacts on health than at least 75% of all other tracts in the nation. But this map is really just the highest level at which you can interact with data using the EJI Explorer. There's a quick start guide over here on the left, which walks you through ways to focus in on an area of interest in order to dig deeper into the data. For example, you can use a these drop-down menus to select a particular US state or county. You can also use our address search in order to find a particular point or area of interest. Now, selecting a particular census tract or neighborhood brings up this pop-up that can give you information like the neighborhood population, as well as the percentile rank scores for overall cumulative impacts, as well as all the different components of the EJI, environmental burden, social vulnerability, and all of those indicators included in overall index calculation. You might also notice that there are these red symbols next to some of these scores, which identify that the neighborhood you selected ranks higher for that measure than at least 75% of all other census tracts in the US. So it's essentially just an easy way of highlighting factors that may be contributing to high overall cumulative impacts rankings. So going back to that eji.cdc.gov page, there are a number of other resources available to you to learn more about the EJI and access the data behind the mapping tool. So on our data, we have a data download page where you can download the full EJI database, which includes not only percentile rankings that are available on that EJI Explorer map, but also all of the underlying data used to calculate those percentiles. There's also a helpful data dictionary that can walk you through the definitions for all of the different pieces of that database, as well as the sources for those data. We also have detailed technical documentation for those who really want to get into the weeds on theory, methods, and the scientific basis for EJI. This technical documentation includes everything from details on our model and indicator selection to even some example index calculations for census tracts that graphically display how data are transformed and combined into index scores. The technical documentation also includes details on each indicator, including exactly what each indicator represents, the data source, data year, and a rationale on how that indicator contributes to those cumulative impacts of environment on health. We also have helpful FAQs on how to use the data appropriately, how to cite the data, select limitations of the EJI, and we have finally a downloadable fact sheet which can kind of walk you through some of the definitions. It's easily printable, and it even has some case studies that kind of talk about that concept of cumulative impacts and what that actually means. I also want to mention that we really like to get feedback from people who are using the EJI, and that we're always happy to answer questions related to the tool. So we have posted on our site this EJI_coordinator@cdc.gov email, which we monitor daily and try to respond to quickly. So really quickly, I want to walk through some very important limitations that always need to be considered when using a tool like the EJI. The first thing is that the EJI does not define or label environmental justice communities. That's not what the EJI is designed to do. We're designed to offer context and comparison, but not to apply those kinds of labels. The EJI also doesn't characterize all relevant environmental or other issues. There are some key data gaps out there that prevent us from measuring some environmental factors. This means that whenever possible, information from the EJI should be supplemented with local data in order to provide a clearer picture of cumulative impacts facing communities. Another very important consideration is that the EJI is not designed to tell an individual or community their level of risk or exposure from environmental hazards. Again, EJI is useful for providing context and comparison, particularly when considering factors cumulatively. But the EJI is not a substitute for a health risk assessment or another kind of more detailed and quantitative approaches. Finally, it's important to note that the EJI does rely on historical data generated by different agencies on different timescales, which does mean that not all data come from the same exact time period, and that some data are by necessity not as up to date as others. Though we do try to use the most up to date data when we release new data every 2 years. So how do we envision the EJI actually being used? Well, the EJI can be used to do things like identify and prioritize areas that may need special attention or additional action to improve in health and health equity, to educate and inform people about the environmental, social, and health factors driving cumulative impacts within communities, to analyze those unique local factors driving cumulative impacts on health in order to inform policy and decision-making, and finally, to establish meaningful goals and measure progress towards environmental justice and health equity. I want to really quickly uplift one of my favorite examples of the EJI in action, which is in November of 2022, the U.S. Assistant Secretary for Health, Admiral Rachel Levine, actually issued a letter to the New York Metropolitan Transit Authority commenting on a planned program to toll vehicles that enter or remain in the downtown business district of Manhattan. A lot of the initial studies of this program suggested that this move could lead to increased noise and traffic in areas along the Cross Bronx Expressway, something that communities were uplifting as an issue. Admiral Levine's letter pointed to high levels of cumulative impacts already facing the communities surrounding the expressway, as well as to particularly elevated scores for diesel particulate matter from trucks, air toxics cancer risk, and the prevalence of health vulnerabilities like asthma and diabetes. That letter also provided actionable suggestions for improving health equity, including installing air filtration systems in schools around the expressway, prioritizing nearby bus depots for the deployment of zero emissions buses, and some other health protective measures as well. And those measures were ultimately incorporated, many of those measures were ultimately incorporated into the New York Metropolitan Transit Authority's plan. And the New York Metropolitan Transit Authority ended up using the EJI to help identify communities in which to prioritize those health protective measures. So really quick, I want to make sure to emphasize one last thing, which is the importance of community engagement in our work. Procedural justice through community engagement is a principal tenet of environmental justice. Environmental justice requires that communities are given a place at the table, and that's something that we've been working to do with this tool. Since the launch of EJI in 2022, we've participated in dozens of listening sessions, community engagement workshops, and other events where we've incorporated feedback or gathered feedback on EJI methods and resources, which we're working to incorporate into future updates to the tool. So we really do appreciate whenever people reach out with feedback. Just know that that is always going to be listened to and something that we're going to consider in making updates to our tool. So with that, I'd like to thank everyone, and I'll go ahead and open the floor for questions if there are any. Thank you.
Thank you, Ben. We do have a question from the chat. Ben, this is from Malcolm. Ben, I understand needing a cumulative impact method to synthesize ecological, social, and health vulnerability into one metric. But have you had complaints about a lack of transparency? Perhaps the cumulative impact obscures the data at the source. What is our duty as EJ advocates to get more specific than just a generalized index?
Absolutely. Yeah, I think one thing, I think the way how I'd like to respond to this is by saying the EJI is definitely at least I very strongly believe it is a very helpful tool for providing some of that national context and comparison. We do always try to provide as complete transparency as possible in how we actually transform the data. That's why we provide that technical documentation that's nearly 100 pages and really tries to walk through every step of how our index is calculated. But there's always going to be that aspect of using national level data and not when using national level data, it's difficult to incorporate all community level concerns, right? And we're also not able to communicate all data that might be measured hyper locally in that community. That's why we always try to mention, EJI is not it's not a silver bullet. It's not a one-stop shop resource entirely. It is always important to supplement that kind of national level context and comparison with those hyper-local data that are available to communities. And we always try to mention that that's something that we encourage with the EJI. It's important to get both that national level perspective and that super local level perspective, especially in environmental justice work. So I really appreciate the question.
Okay, thank you, Ben. I'm not seeing any hands raised. My colleagues on the line, if you see anybody, feel free to jump in. But in the interest of time, I think we can go ahead. Not seeing any, so let's move on. Mitra, you
Sure
want to go
thing.
ahead?
Yep. Great to be here with you all today. My name is Mitra Kashani. I use she, her, or they, them pronouns. I am with the CDC as well, but specifically the CDC tracking program. And I'm going to talk to you guys today a little bit about the tracking program and some of the tools that we use to kind of bring health outcome data and environmental outcome data all into the same place. So let me share my screen. Get your presentation mode. All right. Yeah, so again, my name is Mitra, and we're going to talk a little bit about the Environmental Public Health Tracking Network. So the tracking network at CDC primarily serves as a kind of one-stop shop, if you will, or we're attempting to break down a lot of these silos in different, data sets and indices, what have you, that are related to public health or at the intersection of public health and environmental health and hazards and exposures. So our main mission is really to bring information to people in an accessible way. And we try to provide this in ways that are meaningful to a variety of stakeholders, whether it's healthcare professionals, community members, policymakers, academics, and just other community members. So we bring together data from everything related to environmental exposures and hazards, such as the ones that are listed on this slide, to different health effects and health outcomes. For example, asthma data, cancer, heart disease, and stroke. And we also factor in different population characteristics and demographic data. And we try to provide all of these data sets in our tools so that users can query them and explore potential trends or other overlaps with some of these questions in environmental and public health. And to do all of this, we can't do it by ourselves. So I work with a lot of science communicators, environmental epidemiologists and researchers, IT specialists, and data scientists. And that's just within the tracking team itself. The data that we get comes from a variety of different sources, whether it is other agencies that we partner with, such as NOAA or EPA, or other divisions within the CDC. So we work with Ben, we work with, getting the EJI and SVI to be on our portal. And we also work with other divisions within the CDC to get health outcome data. And also importantly, the tracking program funds different state health departments, and we work with them to build local and state level tracking programs that essentially, focus on the same topic area as us, so environmental public health, but we also acquire data from those state health departments and those partners. So every year we require at the very least an emergency department and hospitalization data related to some key topic areas, including asthma, COPD, cancer, and we also get data on water quality and a couple other kind of very important to us topic areas. But again, the takeaway here is that we work with a lot of data stewards across the board to provide us this information and again, kind of move that goal forward of breaking down some of the data silos that we keep confronting. So really quick, just want to go over some of the different data tools and surveillance tools that the CDC tracking network houses currently. So our flagship tool that I'm going to demo today is something called the Data Explorer. This is a publicly available tool. It's interactive, and it houses over 800 measures, and I'll talk a little bit about what we mean when we say measures in a second. But yeah, it houses over 800 measures or kind of like tidbits of data, again, related to environmental health, exposures, hazards, and then population level data and health outcomes. This data, again, I'm going to demo this tool. You can view it through different data visualizations, including a standard choropleth map, charts, tables, stuff like that. And yet there are various levels of customization for visualizing the data as well. It's also all downloadable. You can export images, and then you also have the option to visual or embed the visualizations that you see on our Data Explorer onto your own website or web page, whatever. If you are building your own tool and just like a kind of snapshot of a particular measure or data set, you can use our data visualization embedding function to embed that the same interactivity into your own web page or program. We also have several dashboards that are more specific to a topic area. So that includes an environmental justice dashboard, a melanoma dashboard, and we pull the data for these dashboards from that first tool I mentioned, the Data Explorer. But it's just an opportunity for users to hone in on a specific topic, and you can also customize it and curate it to your location or a location of interest. So for those tools, you just type in a zip code and it gives you these snapshots of contextual information, for example, related to environmental justice for a particular zip code or county or location that you enter into the dashboard. So again, it just kind of contextualizes and provides more hyper-specific information on a specific topic. And then finally, I kind of alluded to this already, but we do have an application program interface or API that can be used by developers if you're creating your own apps or websites and you want to feed that data into your own website from our Data Explorer. You can do that via an API. And then again, I'll go over that data visualization embedding function too once I do the demo, which could be useful again for just applying that same kind of snapshot of a particular topic area with the interactivity that you get in our Data Explorer tool. So again, for the purposes of today's demo, I'm going to go over that main flagship tool that we have, which is the Interactive Data Explorer. And before I go into the demo, I'll just keep this slide up for a quick second. If you have any questions for us after this presentation, best way to reach us is this email here, trackingsupport@cdc.gov. But you can also follow us on social media and visit our website, which is www.cdc.gov/EPH tracking. All right, and with that, I'm going to switch over to the demo. Can I just verbally get that you guys can still see my screen and can see the query panel from just one person?
Yes, we can.
Beautiful, thank you. All right, so I think the link for this query panel is dropped in the chat. So feel free to follow along or just explore the tool on your own if you'd like. But if not, I'm going to kind of demo, again, this Data Explorer tool, which is one of our main tools, and just some of the different environmental health or health outcome data that you can explore and query in it. So once you open the link, you're going to end up on this initial landing page, and a query panel should pop up just like this. And you're going to see different kind of steps that help you build your query, essentially. So for some quick context, in this step 1 here, you have the option to, or the opportunity to select the topic area you want to explore and kind of get a little bit more granular into the different metrics and characteristics that we capture under that content area. So step 1, the content area itself, I guess, is just a high-level topic area that captures a lot of those other characteristics and metrics. So for today's presentation, I'm actually going to switch over to this tab. I've already pulled up a query that we can look at, but I've selected this precipitation and flooding content area. Really quick, before I get any deeper, I just want to show you all that we have currently around 30 different content areas. Again, this high-level topic area that you can choose from. So I'm going to stick to precipitation and flooding. The next little sub-step in step 1 is to choose your indicator. So indicators are really just categorizations for capturing one or more items or characteristics that provide more information about, that particular content area you selected. So the environment, other factors, populations, health status, and so on. So for today's demo, I've selected historical precipitation as one of those indicators that are available under the precipitation and flooding content area. And then finally, the last step in this step one of selecting your content is to select a measure. And this is really the data that you're visualizing and exploring. So the measure is essentially a summary characteristic or a statistic, like a sum, a percentage, a ratio, proportion, and so on. And that is that measure is what is capturing, again, the metric that you are exploring. So for our demo today, I am looking at monthly average of daily total precipitation days for a particular area, and then we'll kind of go into how you can query the geography and time in just a second. So step two is where you select your geographic level of, for the data you want to explore. So the granularity, and this, I should mention, varies based on the data set that you're looking at. So for this particular demo and this particular data set, we have data available at the finest granularity at the county level. And again, I'll talk a little bit about limitations and kind of the considerations that go into why a data set might not be available at the census tract level. Again, that is often related to the data source, so who we're getting the data from. If they don't have it, for example, geocoded down to the census tract level, or don't have the information for us to do that geocoding, then we have to kind of work with the geographic level that we have available. So again, for the precipitation data we're exploring today, we have that available at the state by county level. And usually most of our measures have at least a national level map too. So if you wanted to look across the contiguous United States, and some different measures and data sets will include Hawaii and some of the other US territories as well. So the third step in selecting your query is to pick the geography. So since I've selected here state by county, it gives me the option to select the state that I want to look at. Since we are looking at flooding, and I'm sure many of you have kind of been keeping abreast of some of the natural weather events that have been happening, or the hurricanes that have been happening in the US. And one of the most recent ones was Hurricane Helene in North Carolina, which led to unprecedented extreme flooding and precipitation. So kind of to explore past trends in precipitation, I've selected North Carolina for today's demo. And then step 4 is where you can select the temporal scale of the data you're exploring. So the time, this is monthly. Again, I want to highlight this is monthly average data for what we're looking at today. So I've selected the year 2023, and what we're going to see after I hit go is the possibility of looking at this data for the whole year, year by month for the year of 2023. And for this one, you could even select multiple years if you wanted to kind of explore trends over several years. And then sometimes, depending on the data set, again, you'll have these advanced options, which just allow you to customize the query, perhaps for a particular population or a particular kind of like threshold for precipitation and stuff like that. Depending on the data set, you may have some advanced options that can customize your query a little bit more. But for today, for today's measure, there are no advanced options. So once I'm good with my query, my selections, I just hit go. And here is our first kind of initial visualization of that query. So what you guys are seeing here is a standard choropleth map, which outlines the different counties in North Carolina. Here on the bottom right, you'll see a legend that's color-coded. The color scale starts from this kind of lighter yellow to this darker blue. And we are measuring, again, historical or monthly average precipitation in inches. So these are the the inches of rain, I guess, by averaged for that month that we are exploring. So our map is starting in December of 2023 for right now. And if you hover over the different counties, you'll get the average daily precipitation for that particular county. So now I want to quickly highlight some of the different widgets and functions that are on the map that can contextualize this data a little bit more, and different ways that you can also visualize it beyond just a choropleth map. So first thing I'm going to select is this About Data green button up on the top right. And this includes some really important information as you're looking at your query, including these footnotes. The footnotes are essentially a list of caveats or potential limitations to the data, other things that you should, kind of keep in mind as you're exploring the data. And often if there is a consideration for comparison, like should you compare this data to something else, we'll include those considerations as well. So the footnotes are a great first stop shop to look and contextualize the data you're querying. The other thing I want to draw your attention to down here is this indicator header. We include a link to this indicator that you're exploring. So if I select this link, if you want to learn more information about the indicator itself, so we're kind of taking a step up higher from the measure, I guess, but you can read a little bit more about how that indicator was derived, what the data source was, what the geographic scope and scale are, time periods and time scales for that particular data set. And we have some limitations, other considerations, and of course, like I mentioned, the data source that the data you're querying is from itself. So these are all kind of important links and places to explore and contextualize the data you're looking at. The next thing I want to highlight is, let's go over here, again on the top right. So right now we're in the map view. But let's say you wanted to view your data as a chart. So I click this charts button here again on the top right. Right now it's this horizontal bar chart, but maybe that's not really helping me. I want to look at it from a vertical bar chart perspective or trends over time. So you have the option to customize your visualization and your chart specifically. For example, if you wanted to look at a trend chart. And I'm probably not going to apply this just for bandwidth purposes. Finally, you can also explore the data as a table. So you can export this table and explore and, run your own analyses if needed on your own end. So whatever your end use need is, you are able to just extract the data from this table. The other thing I would like to point out is so export data is what I just talked about with exporting the table. The data visualization embed again, which I kind of hinted to earlier in my presentation. This is again where you can embed that map that you were seeing onto your own web page, program, what have you. And all you really need is this little line of code here it's just some basic HTML code that you can use to embed, again, the same interactivity that you were seeing in the map itself onto your own web page. So that is a really neat tool. We kind of do all the work, clean up the data, do all the processing, and you can just use the map for your own kind of like end use and needs. All right, and the last thing I want to show you guys is I'm going to go back to my map view here. So what I just did, I'm going to try to zoom out a little bit, is I expanded this side, the second map on the side using these arrows. And this is a really neat functionality that allows users to explore two different data sets side by side with the option to link the two maps together. So that's what's happening here right now. You can see the different counties are being highlighted next to each other. So I've done the same thing. I ran a query here on this second map for the social vulnerability index, which we heard about today. And so again, we include data on the environmental justice index and social vulnerability index in the tracking data explorer. So I selected the social vulnerability index, and let's say you wanted to explore vulnerability rankings for areas that are experiencing higher levels of flooding. So that is an option that you can explore using this map menu selection. And I just hit link maps. And I can kind of explore some of the trends and patterns in social vulnerability and historical precipitation. Last thing I wanted to share before I kind of stop talking and let folks ask questions is this play timeline button here. As I mentioned, this data that I'm demoing today is monthly average data, so for the whole year. So I've selected for 2023. So if I hit this play timeline function, then you can see the kind of changes in average monthly or monthly average of daily total precipitation over time over the course of 2023. So again, this is just a neat way to see some of those trends and changes over time for this particular data set and others that we have available. All right, just thinking if there's anything else. Oh, the last thing I'll say is that if you wanted to share this particular query link with colleagues, other subject matter experts, community organizations, you can just hit that share widget on the top right and copy this link directly, and it'll share exactly the selections that you made for that particular query with whoever receives the link. And then the API link is also included right down here. All right, I will stop there.
Thank you, Mitra.
Thank you.
And thank you to all of our presenters for walking through those tools. It was super helpful to see that. Mitra, we have one question from the chat. Are you connected to the CDC Foundation Climate and Health Initiative? Sylvia says, I became aware of the initiative and wondered if there's another funding window. I used EJ Screen data to qualify my community.
Let me see, Climate and Health. Yeah, so I don't know about the CDC Foundation Climate and Health Initiative, but we work very closely with this, I guess, I don't know if they're a branch, but we do work with CDC's Climate and Health team. So we collaborate with them very closely on our environmental justice dashboard, which helps display the environmental justice index too. And we also work with them on the CDC's heat and health tracker and some other dashboards. So I'm unaware of the funding, but we do work with climate and health at the CDC.
Okay, great. And then we have a few questions around, and I think this is for all of your tools. So if you could just answer quickly, how often are the data updated for each of the tools, and when will 2024 data be added?
Yeah, so to answer this question, so it varies by data set. And I think that's one of the perhaps challenges with kind of the work that myself, even Ben and others do, is that we are kind of at the mercy of whoever our data provider is. So we really try to have annual updates for most of our measures, especially what we call our nationally consistent data and measures. Those are, some of those asthma, hospitalization, health outcome data sets. So we get those every year, 2 times a year from our state and local health departments that we fund and work with. But for other things, for example, the precipitation data that I've demoed today, we get that data. It's NLDOS, if you guys are familiar, the Northern America Land Data Assimilation System. And the latest, year we have is 2023. So we would have to check if NASA has updated that data set for us to get the 2024 data. So I'm not the subject matter expert on this particular data set that I demoed today, but I'm happy to check for anyone who is interested in keeping tabs on that. If you want to reach out to me after this presentation, I'm happy to connect with you. Drop my email in the chat.
Thank you. Matrini asks, for housing layers, do they connect with the HUD database?
Housing layers, let's check. I'm not sure we have HUD data right now. Let me check on that and I'll reply directly to you, Matrini, if that's okay.
Okay, if you have any other questions for the presenters, please go ahead and raise your hand. We do have some questions just to start off discussion in the meanwhile. So one one of the results that we saw in that poll at the start of the webinar is, a lot of people view federal tools that they are familiar with as complex, or they're associated issues with access, high learning curves, things like that. So for the presenters, what are there trainings or classes available for how to use these tools? Is there a way for users to receive personalized assistance? And relatedly, what can we do at the Urban Waters Learning Network to help to share these tools and reduce accessibility barriers?
That's great. And I can jump in first here, and say, yeah, we do everything we can to try to make this as accessible and easily understandable as possible. But if there are any questions, please feel free to reach out to the SVI_coordinator at cdc.gov. We'd be happy to walk through anything or talk through anything with you. But we do, like I said, try to have a lot of information on the website. So, through the documentation, through the FAQs, it definitely would recommend starting there, and then exploring what information we have on the website first, and then but yes, we're more than happy to chat with anyone if there are additional questions.
Yeah, I'd definitely like to echo that from the EJI side of things. We try our best to make our materials accessible. I know that's not always, there's always going to be questions and layers of complexity that we're not, able to simplify as well as we wish. One thing I'll say also is that we always like comments about how we can make our material more accessible. Again, if you reach out to either the SVI or EJI coordinator, we do always take those comments into consideration in the updates that we're making to all of our materials. And thank you, Natalia, for putting those emails in the chat. We also, again, like with the EJI, we're always happy to help walk people through any questions that they may have about how to use the tool, or to arrange trainings or consultations if possible. So I would say always start at the website. See if you can use those FAQs to answer your questions. That's why we try to make all those available. But we are always happy to try and follow up with you and help you to use our data for whatever you're doing, because it's no use if our data is sitting there on a shelf.
Yeah, I'll just echo what Ben and Elizabeth said and say, reach out to us if you have any questions or even potential data sets that you don't see on the Tracking Data Explorer and you feel like would be really valuable and is like lending to like a dearth in data. That's what we're here for. Like we really want to make these different topic areas that are hyper relevant to our communities more and more every day, available to all of our stakeholders and communities especially.
Great, thank you. We are also getting some helpful comments and feedback in the chat too. So if you can't see those, we can make sure and get those to you as well. One of them is related to one of the questions we have. Comment that it would be useful to have a common single-click dashboard that can access all of the tools from one place. That's sort of related to one of our questions around what is there anything in planning stages for something like that, or what are the opportunities for collaboration and synthesis across the different tools?
I can hop in with a kind of a first take on that. So number one, there are places where all of these tools are kind of combined into a single place. The National Environmental Public Health Tracking Program's Data Explorer is one kind of way that you can dig into all of these different indices and access them along with a bunch of other data sets. So all of that is already available on the tool that Mitra showed you. I think the reason that each index has its own tool available for viewing the data is the same reason that there are multiple indices out there and multiple tools out there. It's that they're not all made for exactly the same purpose. So someone who is using the the tracking program's data explorer is going to have one purpose that they're going to be trying to use. SVI, SVI users are maybe a different kind of group of people with a different group of purposes that they're using the tool for. And same thing with EJI users. So we're all kind of drawing from suggestions that are being brought up by our user bases, developing tools that help people to access the data in a way that's most useful for them. But definitely understand, if you're looking for a one-stop shop, that does exist. It just might not be the thing that every single data user is looking for, because they're going to all want to access different kind of levels of data, levels of information with different kind of context. So that's my answer. Mitra and Elizabeth, feel free to hop in with anything else there.
No, that's
Well
perfect.
said.
Okay, another question, I'm sure this is on many people's minds right now. How do you see the usage and investment into tools like these changing, if at all, with a change in funding and priorities due to the incoming administration?
Yeah, I know we talked about this a little bit earlier today, and I'm not sure, Ben, if you want to provide the answer that you described earlier, but yeah, it's generally speaking, there's a lot of unknown at this point, so we are going to wait and see, essentially.
Yeah, just to expand on that a little bit, there are a lot of unknowns. I don't think anyone in this country has a great answer to, that question, honestly. But what I will say is that, you know, these tools, most of these tools at least, have existed for a while. They've existed through multiple administrations. And so far, the programmatic work, how that looks day to day changes, how that gets amplified or used in policy can change, but we've continued to do the programmatic work from day to day, and hopefully that's going to continue into the future. Thanks.
Exactly. Nothing more to add. Just echo.
Thank you. And for the presenters, I see you're in the chat. Are there any of these that you would like to take and use as an opportunity to give a demonstration of any of the tools? Some of these longer examples, or do you want to respond individually to these? So Margaret posted, I live in Brunswick County, Virginia, with the highest percentage of diabetes, hypertension, kidney disease, and all types of cancer than any other county in the Commonwealth. I would love to see how each of these presenters would calculate and pull these numbers and give some input on how, why, and what is impacting these figures. You tell me if it makes sense to respond now or if you want to respond personally.
I think it might make sense to respond via email, just because there's a lot of questions here and there. I'm having trouble kind of reading through all of them. But I think these are all great questions and would be great to follow up on. So thank you.
Great. And I see we are coming up at time. If you all want to make sure that your emails are posted in the chat, and that if you want to just post anything that is like the first point of access for people so that they all have the opportunity to reach out to you individually, that would be really great. Let me see if there's anything else I missed. And Julissa, feel free to hop in here if there's something I didn't ask. Here's one. To what extent have you collaborated with other federal agencies to develop these tools or to ensure that they can be used in a complementary manner with tools offered by the EPA, for example?
I mean, I can start really quick. I think inter and intra-agency partnerships are like the foundation of the tools that we build. So just having health outcome data from state health departments really is not enough to contextualize all of the different stressors and exposures and hazards that can potentially be, causing some of these trends that we're observing. And I guess kind of was it Margaret, your question about Brunswick, Brunswick County, Virginia? Yeah, I mean I will definitely follow up with you via email because this is what the tools that we're developing is really to provide all of these potential kind of pressure points for people's health and exacerbating vulnerabilities, having it in one place and then allowing it to be accessible for researchers, medical professionals, health professionals to ideally explore some of those trends and to like really dig deeper into why your question of why, like why are we seeing these trends? What are all of those different those factors that are leading to these higher percentages of diabetes and hypertension? So yeah, I'll stop there and I will follow.
Thank you so much, Mitra. Welcome whatever you can give.
Will do.
Thank you so much to everyone. Please use the evaluation. We love to get your feedback on, what you learned from this webinar and how we can improve, or reach out to any of us directly. I'm going to post my email in the chat in case you want to reach out to me directly. And thank you everyone for attending, and thank you to our presenters for these wonderful presentations. We really appreciate your time. Have a great afternoon.
Thank you all.
Thank you so much.
Maria, thank you so much for putting this together. You did a fantastic job, and so did everybody else. Thank you.
Thank you.
Thank you for your great question.